I had a lot of requests last time I did this because it was such a hot topic about exchanges. But I wanted to touch on this because it can be very confusing. And I don't know how much you've been keeping up with all the crazy things exchanges we hear about, on the nightly news about the state exchanges. But the reality is that it's a very complicated vocabulary if you're not involved with it, not listening closely. You can be very confused because there's something called the Health Information Exchange, HIE. Anybody know what that is? That's where providers are connecting electronically to pass information back. Your lab work, your x-rays, your doctors and your hospitals are talking. That's been going on for years, and the government's been giving states a lot of money to try to connect all these entities that really hadn't talked to each other in the past. So that's the Health Information Exchange. Notice that's an HIE. And I try to differentiate that with my own shorthand, which you won't see in the media, but I call it a Government Health Information Exchange, or GHIE. Okay? Now, what you've been hearing in the press is about health insurance exchanges, which they don't call exchanges anymore. They call them marketplaces. Which, curiously enough, I heard one bureaucrat the other day said, I hate calling it marketplace. It's like, that's free market, So anyway, but they're called marketplaces now, because if they called them health insurance exchanges, what are the letters? HIE. Well, that's already taken. This has been going on for years. This is newer than this. So this gets, rank has its privileges, I guess, So you don't call these HIEs anymore. They call them HIXs. So if you're reading newspaper articles and they talk about HIXs, that's what they're talking about. If they're talking about marketplaces, it's the same as an exchange, but it's all about insurance, not about the information, the medical information. Now, for both of these categories, there are actually private versions of these. There's a private health information exchange or marketplace, and there's a private health insurance marketplace as well. So here's the definition again of the information exchange. Typically transmit health-related data among facilities, health information organizations, and agencies according to state or federal standards. So that's been going on, and a lot of people think we wasted a lot of dollars on that, but some states have made some good progress. But it's typically, I think, been more by state. All right, on the health insurance exchanges under the Affordable Care Act, or PPACA, you can see here that we're talking about who's involved. Well, it's individual purchasers and small groups. And they actually have names, which I've not seen in the press lately. But the individual exchanges that we're having so much trouble right now are actually called American Health Benefit Exchanges. But I never see that anyplace. But in the law, that's what it's called. And then this one is the one that's been put off, the Small Business Option Program, or SHOP exchanges. So you hear about SHOP exchanges, that's for the small group, again, which has been put off for a year. So exchange terminology can be very confusing. If you're an employer of 50 or more, that's when you get into this shared responsibility, they call it. This is the employer mandate, or the penalty that's, again, been put off for a year. So, if you, there's a penalty of $2,000 times the number of full-time employees minus sort of a 30-employee deductible that they give you. If the employer does not offer a qualified health insurance coverage, and at least one employee receives a tax credit for the purchase of insurance through an exchange. So just one of your employees gets a tax credit, and you're not offering a qualified plan, it's $2,000 times every employee you have, less 30. Big penalty. Nobody wants to be in that category. Nobody wants to fall in that. Walmart would be paying $2 trillion or something, $1 billion. Now, if an employer offers a qualified health insurance coverage, but at least one employee declines insurance coverage and gets a tax credit subsidy to buy insurance through an exchange, then the annual penalty is the lesser of the penalty for the employer mandate, or $3,000 times the number of full-time employees who receive tax credit. So it's the individual employees. So if you're offering a good plan that qualifies and it's too expensive for the employee so they can go to an exchange and get a subsidy, then you'd pay $3,000 for that employee. Some employers, my daughter actually worked for Newell Rubbermaid, and they put in a program, and they actually put the government exchange as one of the options. They said, if you want to go to government exchange, fine. We're going to develop the programs we think we need for our employees. And if it's more than 9.5% of your income, whatever the test is, go to the exchange, get a subsidy. Because the $3,000 penalty we'll pay is actually less than the amount of money we're putting into an employee programs anyway. So as an employee, you can actually put that in as one of the options.